There's a very interesting guest on the program. It's a guest from Israel, so please find the Czech channel for interpreting. And our speaker is Mrs. Talia Meital Schwartz Tayri. Mrs. Schwartz is a researcher of social work at Ben Gurion University in the capital of Negev in Israel. And I myself am very curious about experience from this desert region. We're for sure going to hear something new, something from a different environment and the Israeli experience. So Mrs. Schwartz called her contribution on the front line impacts on social workers in Israel. So good morning, Mrs. Schwartz.
Thank you very much. So is that okay to start now?
The floor is yours.
Great, yeah. Okay. So as you already heard, my name is Talia and I'm a researcher at Ben Gurion University in Israel. And I want to present you now with a study that I started at the time that I was a postdoc at UC Berkeley. Actually, I was still a postdoc a few months ago in the US. And the study focuses on social workers during the first phases of COVID-19 in Israel. And as you've already heard, probably, there have been many reports on how social workers fared during the outbreak and the continuing COVID-19 crisis. And we know that social workers were first respondents to the social and economic rapidly growing needs caused by the spread of the virus. And as first respondents, social workers, similar to medical staff, they have had and they still have to prioritize urgent situations. And across countries, not only the demand for social services has increased, but also the reports on domestic violence and on child abuse. And in Israel, just for example, only during the first lockdown in March 2020, reports on child abuse increased by 660%. And overall, from the start of the crisis, Family and Child Protective Services experienced a 26% increase on reports on domestic violence and almost 21% of child abuse. And compared, of course, this data is compared to the previous to the same period the previous year. And now, despite of these hardships, social care services in Israel have suffered from social distancing regulations, from staff cutbacks, and in some cases, total closures of services. And as a result, Israeli social workers have had to deal with massive nationwide workload increases, with limited workforces. And what happened is that surprisingly, although the Israeli government legislated emergency regulations that declared all social workers to be essential service providers, there were still agencies that during the pandemic's first wave had to dramatically limit staff. For example, some of the residential care services for children and youth, national and transitional housing programs, facilities for children with special needs, and services for people who live with disability. And reports made to the Israeli Social Workers Union informed that many sub-services and agencies that are operated by the local authority and by privatized services had to close some of the services and send home their social workers because they were still partially dependent on civic funds. And many of these civic funds stopped immediately after the first outbreak of COVID in Israel. And as a result, these staff cutbacks and service closures have increased the demand that were placed on frontline social workers because for the most of the time, they continue to working face-to-face with service users and many agencies, of course, in charge of working with risk elderly, and they had to increase home visits, especially during the lockdown. And Israel had 3 lockdowns. So to sum it up, the pandemic exposed social workers to multiple stressors, not only extreme work demands, but also the need to adapt to continually changing social distancing regulations and their exposure to the virus, which was probably much higher than other populations, comparing to other populations. Now, studies on social services conducted before COVID have shown that service and staff cutbacks have been empirically linked to staff psychological stress. That this psychological stress may result in stress-related problems. And we wanted to know if that was also the case of Israeli social workers during the pandemic. Now, to collect the data, we used an online survey and we invited all social workers registered in the union to participate in the study. We also had 13% of the social workers that were not registered in the union that participated, but all the social workers who participated in the study were more than 2,500, and all of them were active, licensed social workers. I'm not sure that I have time to speak about the research tools, but I do want to say that after the questionnaires, we invited the participants to share with us their stories on how COVID-19 affected their professional lives and their personal lives. So we had 4 open questions. Now, because we ended up having more than 1,000 long answers, we could not manually analyze them. So we used a machine learning algorithm that was trained to identify 6 types of emotions. I just want to say regarding this slide, just want to mention that the sample included social workers from all the communities in Israel. I wish we had a bigger representation of the Arab society. That would be even more representative, but unfortunately only point, I think if some of the Druze community and some of the Muslim and the Christian community, most of them are part of the Arab community, Arab society. But I think we wanted more. We wanted a bigger representation of social workers from these communities. As you can see here, the sample represents all type of social care services in Israel. And I want to say a tiny word, a tiny sentence about the public sector, why it's so big here, because we know that many of social work services, social welfare services are provided by privatized, in a privatized way, and also by NGOs and private organizations. But social workers who work in privatized organizations, they know that the government financed their agency. So although it is operated by an NGO or a company, they still see themselves as part of the public sector employees. And that is why you see the 79% of the social workers belonged with the public sector. The first interesting finding, I think, is the fact that social workers' job satisfaction after COVID outbreak was significantly lower than it had been before the COVID outbreak. And age, you can see here that I mentioned that age had significant correlation with perceived stress and work-related health problems. So I incorporated it with the research model that you're about to see in a minute. So what happened? What happened to Israeli social workers after the pandemic outbreak? And what can explain these dismal findings? Social workers who participated in the study reported on an average of at least 1 negative change that occurred in their work setting due to the outbreak, due to COVID-19, and their job satisfaction decreased. They also reported on moderate high stress levels, and they, most terribly, they experienced an average of more than 3 job-related health problems. You can see here the frequencies that they are indicating that social workers' workforce has become a vulnerable population during COVID-19. Now, it is important to understand what was the mechanism that may explain this impact on social workers' mental health. And what we discovered here is actually not surprising, especially in the context of COVID. The research model demonstrates that social workers who experience stronger negative impact on the pandemic on their services expressed higher level of stress that contributed dramatically and significantly to greater health problems. And also the decrease that you see in social workers' job satisfaction was also found to be a significant mediator. And that tells us that social workers who reported on greater negative impact on their services experienced greater decrease in their job satisfaction and greater stress and greater health problems. Social workers also shared with us their stories. They also share with us their personal experiences during the pandemic. Especially, we ask them if they will be willing to describe the impact of the pandemic on service users, on their practice, and on their personal lives. And because we received many responses, many responses to these open questions, we used machine learning algorithm that was trained to identify 6 emotions. So we created a data set of only emotion detections above a confidence score of 0.5, and we checked their frequencies. So just for an example, the dominant emotion that was identified here in this specific text fragment was fear. And I hope you had the time to read. The staff of the conference kindly helped me to translate this part, and I wanted you to read it in your own language. And the identified emotion here was fear. It was detected was fear. And as you can see here, overall, the dominant emotions that participants expressed were fear, disgust, and sadness. And less dominant was anger, and even less dominant were trust and joy. And taking all together, the findings of this study reveal once again that working conditions are linked with social workers' psychological stress. And this mechanism was also reflected once again in the context of social care services during the pandemic. Social workers have had to respond quickly to the rise in urgent needs and to the rapidly spreading hardship among known and new service users. And at the same time, they had to handle, in some cases, staff cutbacks, and some services, even in some services, they also closed. The services and program were closed immediately. So this imbalance, together with high levels of fear and disgust and sadness, affected their work, their job satisfaction, and created high level of stress and increased their health problems. And one of the explanations that may help us to understand why the impact of the services of the negative impact on services was significantly associated with workers' stress is the notion of moral distress and moral injury. And these phenomena occur when especially frontline social workers need to prioritize urgent situations against a backdrop of increased demand. And these types of stress also occur when social workers were perhaps unable to provide service users with adequate services during this crisis. And at the same time, social workers in Israel have been dealing with their own potential exposure to coronavirus. Okay. Thank you. I will speak slower. So actually, I am about to finish, but I will be very happy. I will be very happy to hear your question if you have any, or even to hear your thoughts on the study. I do want to say just a few words on what I believe should be on the table of policymakers as a response to these findings, because I believe that these findings are not unique to Israel. I believe that these findings can be also found in other places, specifically in Europe, because of the similarities in social services and the similarities of privatization and the similarities of welfare state and the mechanism of welfare state. And because stress is associated with the immune system, the assistance to social workers should be very quick, because they are still on the front lines. They are still doing home visits. They are still, although some of the practice is online, but for most of the time, most social workers in Israel and outside of Israel and in Europe and the US, they meet face to face with at-risk populations. Of course, because this is the target population of social work. So the response to social workers' stress should be very quick if we don't want to expose them to harm of the immune system. And in particular, during times of national crisis, it is imperative that the government and public service employers provide social workers with comprehensive guidance and supportive supervisions. And of course, some very effective screening tools to monitor workers' exposure to stress should be implemented. And in the case that high level of stress are indicated, very quickly to provide social workers with readily available sources of support. So thank you very much for listening. I would love to hear if you have questions or if you want to share your thoughts on the study and its findings.
Děkuji paní Schwartz za představení.
Thank you, Mrs. Schwartz, for introducing your research of the impact of pandemics on social workers in Israel. It is very important to pay attention to them, because usually this emphasis is on the other side, which are the clients. I would like to ask you, Mrs. Schwartz, in the past 2 days, we spoke about what's the image of social work in the media, that currently we can hear that the increase of the importance of social work, and what actually happens if social work is missing in society, which you may have experienced due to pandemic measures. I would like to ask, do you see in Israel that the image of social work has somewhat changed? Is it a chance to communicate the importance of social work more towards the public?
I totally agree with you. And I'm very happy that you asked this question, because these findings were reported in the media in Israel. And it has been more than 1 week that I received phone calls from the union, and I received phone calls from organizations that want to help social workers. And I received phone calls from social workers, and I received phone calls from the press. Because now the importance, and I can very much relate to what you said. Now it's like the time for social workers to rise. And I know it's a very, very challenging, very, very difficult, not only challenging, it's a very difficult time for social workers. I mean, we saw the findings and we communicated these findings to the media and they immediately embraced it and published it one time and in this channel and in this channel and in the press. And it looks like it's a good time for social workers to speak out. It's a good time for social workers to communicate with the media and to give the citizens the true stories and true cases, of course, with keeping the confidentiality of the patients and of the clients and service users. But it looks like also it is a very sensitive time because now new citizens that were not known to the welfare system, they are now engaging and they are getting to know the welfare system. And now they see how heroic social workers are behaving during this pandemic. But still they also see how hard it is to be a social worker. And I think if social workers want to raise funds and they want to change policy, I think this is the time, even to protect the welfare system, because in many countries, what they're talking about, especially in Israel now, there is a very big talk on now cutting the welfare system immediately after the election. In a week from now, we have elections in Israel, and they talk about cutting as a part of, getting back to normal and bringing back all the money that were spent during the crisis. And I think that they should stand now and object this, even just the talk, just the idea of cutting in the welfare. And so definitely this is a good time to communicate findings, to communicate stories, to communicate a new image of social work in the media. And it is a good time for policy making, for policy design by social workers and led by social workers.
Děkuji.
Thank you very much. We also have other questions. We have seen in your list of cuts negative facts brought by the situation, but I have the question from the charity of the Czech Republic whether social workers in Israel also perceived positive changes, for instance, implementation of new procedures, innovative methods that can be used post-pandemic also without emergency statuses and so on. Would it be able to use any of those innovative approaches later on?
Yes, I can tell you about one main initiative that social workers have done in Israel is that the community social work have really led a very, I think, very responsible reaction to the pandemic. And I think Israeli social workers are used to work direct, social work. And during the crisis, they understood that things must change. And the community social work and social program implementation was much more effective especially during the lockdown. And so I think we haven't checked it yet, but what the voices that I hear from the field of social work, and I'm in touch with social workers all the time, is that it was a rise for community social work, and that it was a rise for program planning and for working with the volunteers in the community, because there were less and less resources. So they had to recruit volunteers, they had to work with the civic society, they had to work using macro practice. So this is what I think it is going to change the face of social work in Israel. And I'm wondering, I'm really curious to know whether it also happened in other countries, the rise of community social work and the rise of community interventions during the pandemic. I know it's only partly answered your question, but I think that it's really interesting to see what happened.
Děkuji, určitě užitečné, děkujeme.
That's for sure quite useful. Your liking question from Mrs. Kunchitska, that it is a very interesting presentation, that the big part of society is focused on how the users of clients of social services feel, but that the personal, the social workers and their psychohygiene is often neglected. Plus, we have another question. I cannot but help myself but ask, because we have certain media information about the vaccination level of Israeli population. Mr. Pilash tells us that his colleague social worker died directly of COVID-19 infection, and social workers have not been vaccinated yet because we suffer from lack of vaccines in the Czech Republic. Could you tell us about your situation in Israel?
I can tell you now that more than 5 million of the Israeli citizens have been vaccinated, and social workers were not the first, but they were the second population to get the vaccine, together with teachers. The first, of course, were patients with at-risk, illnesses and elderly, of course, senior citizens were the first to get the vaccines, and later on was education workers and social workers. But now I think that, as I've seen on the news, more than 5 million of the Israeli citizens received the vaccines. And I have to say that in the beginning, it was not so promising. I don't know, it was still, although at the beginning it was more than 2 million citizens that got the vaccine, there was still another lockdown. And we still have some big populations that refuse to get the vaccines. Some of my students, for example. But I think that we are going in a good direction. I think that we're going in a good direction. And it looks like this is the only window of opportunity to get over this pandemic. But still, I know that these the mutations of COVID are very, very scary, and they're still not sure whether these vaccines are good enough to cope with and to stop this. I'm not a doctor, but I hear what the other physicians say. So it looks like these mutations of the virus, they're challenging the vaccines, their effectiveness.
Díky moc, děkujeme, že jste s námi zůstala i na otázky.
So thank you very much for staying with us also for the questions. We asked you all the questions. So I would like to say goodbye to you.